Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Tim Pflederer. He's a nephrologist, and today's Kevin MD article is How Value-Based Care Transforms Chronic Kidney Disease Management. Tim, welcome to the show.
Thanks, Kevin. It's good to be here.
All right, so let's briefly share your story and then jump straight into your article and why you decided to write it.
I'm a nephrologist. I've practiced for over 30 years in Peoria, Illinois, which is central Illinois, kind of the heartland. And as a part of that, our practice began to transform the work we do from fee-for-service to value-based care, take care of people with advanced kidney disease. And about a year and a half ago, I transitioned into the role as Chief Medical Officer for Evergreen Nephrology because I really thought that value-based care was providing a different level and a better level of care to our patients than what we were doing, no matter our best efforts under fee-for-service.
All right, so tell us some of the challenges physicians face, especially nephrologists, when it comes to kidney care.
Our patients are very complex. They have multiple medical problems in addition to their chronic kidney disease. And our healthcare system's well proportioned to take care of acute illness and has a much more difficult time managing patients who have polychronic disease and really have multiple needs to be coordinated across multiple providers and over an extended period of time. And I think value-based care provides the infrastructure to do that in a different and better way.
And when you talk about value-based care as it specifically relates to chronic kidney disease management and care, what exactly do you mean by that?
Well, at Evergreen, what we try to do is partner with a nephrology practice so that we are working with the nephrology provider as a team, supplementing what a provider can't do. And the provider does excellent work at point of care, making clinical decisions, helping to educate their patient. But between the office visits, the provider really doesn't have a picture into that patient. Mm-hmm. And so we're able to bring a care management team, care navigator, PharmD, registered dietitian, a social worker, to really wrap around the patient between office visits and support them to bring education, to bring help with social determinants of need, and also to just monitor the patient and bring changes back to the nephrologist so that we can intervene proactively.
Now let's take a step back. Now, for those people who are listening, may not be familiar with the effects and symptoms of chronic kidney disease, from a patient perspective, what are some of the things that they need to look out for in between visits to your doctor?
Unfortunately, for many people, they don't really know that they have kidney disease until it's relatively advanced. And it is silent until it may get to the stage where their GFR glomerular filtration rate is low enough that they really are having difficulty keeping up with metabolic processes. So they may start to develop edema. They might start to lose their appetite. They may lose their energy related to either uremia or anemia. The problems that people with kidney disease face are complications of the kidney disease, as well as then also just complications of the comorbid diseases, managing their diabetes, managing their hypertension and their heart failure. So we help patients monitor those things and help them identify early on what needs they have so that we can hopefully keep them healthy and active and out of the hospital.
So tell me, in terms of the type of outcomes that this multidisciplinary approach, tell me, does it reduce hospitalizations and death? And if so, what are some of the data behind that?
Yeah, we've been able in our data to see that we have a profound impact on quality as we bring a patient into the program very quickly. So our patients, one thing we look at is an optimal start to dialysis, meaning a smooth transition to dialysis if that's what the patient needs, where they're healthy and out of the hospital. And our optimal start rate is, across the country for nephrologists, it used to be at about 20%, and now we're running 60 70 and even 80% in some of our practices where patients start dialysis, educated at home with either on-home dialysis or with a permanent dialysis access. We've seen hospitalization be reduced and readmission rates go down. We've seen a delay in progression of kidney disease. It's an early signal yet, but by getting more patients on SGLT2 inhibitors, making sure they're on ACE inhibitors, making sure they're diabetes and high blood pressure, we're seeing that those that we're managing compared to those that we're not have a lower rate of progression of chronic kidney disease. So hopefully that will translate into fewer people crossing into needing a kidney transplant or dialysis.
So, just to give us a better picture of the scenarios, can you contrast this interdisciplinary approach that we're talking about today and contrast that with what normally happens without this approach? Give us a couple of
Well,
stories or scenarios.
absolutely. When I would see a patient in my office before I had the support of a care management team, I would see the patient. I would talk to them about their kidney disease. I would maybe adjust the blood pressure medicine. I would encourage them to follow their blood pressures at home. And I would answer questions and I would schedule them back 3 months from now. I thought during the course of that visit that I had educated the patient and they understood their disease, they understood where they were and what they needed to do, and indeed understood their medications. The truth is that often they came back 3 months later and they didn't. They didn't either follow what I had asked them to do or just didn't report when something changed that I thought I had given them instructions. So having a team who's able to reinforce the message that I've given, provide even more education for the patient, and then touch bases with them over the course of that 3 months has made a big difference in the patient being supported, patient and their family understanding what their treatment plan is, and then being able to follow that and stay healthy. And that's not something that I could do, even with an office staff as a nephrologist.
Now, tell us the type of patients who would be eligible for this multidisciplinary approach.
So inpatient, currently we have a number of different opportunities to engage patients under Medicare fee-for-service. There's a specific program called CKCC, or the Kidney Care Choices model, and the patients are able to be aligned into that and have that benefit as a part of their Medicare. Many Medicare Advantage plans as well provide the opportunity to be a part of a risk-based contract where a nephrologist and value-based care management company like Evergreen can engage with the patient. And value-based care is even moving into commercial and Medicaid populations. So it is becoming more and more available to patients. But for the typical nephrologist, they're still managing many of their patients under fee-for-service without that additional level of support.
Now, are programs like these typically available only in academic affiliated medical centers or urban areas? What about outside of cities?
That's a great question. And no, they're available across the board, and indeed probably more common in private practice and situations where the academic centers, it's more difficult to engage a patient in that holistic way. They can engage them very well in highly specialized tertiary care. But value-based care is certainly throughout primary care in the non-academic setting, and now specialty care focused value-based care is available urban, rural, and in private practice or in larger health systems. The challenge is that many patients have trouble accessing it because of other disparities in healthcare, socioeconomic disparities and racial disparities that we see particularly heavy or impactful in people with kidney disease.
So you talk a lot about those disparities in your article. So specifically as it relates to that, how does value-based care address those disparities in kidney disease outcomes?
We're able to bring a greater level of support to patients who have social determinants of health needs, and and that can really support people who are in especially socioeconomic and racial minorities. So, for instance, often for a patient who's on dialysis, one of the biggest challenges is just transportation, getting to
Hmm.
their dialysis treatment and home. And so under a value-based care situation, there we can bring resources to bear to ensure that the patient actually has transportation. We can address food insecurity. We can address housing insecurity because we are using dollars, if we do this well, that would have been spent on the patient during their hospitalization. We're preventing that hospitalization and able to use those dollars in more preventive upstream care. And that's really true, proving to be true.
Now, from the patient perspective, who may be listening to you now and think this sounds pretty good, how can they go about looking for clinicians or centers that take this value-based care approach to their chronic kidney condition?
Today, the value-based care is really based upon the patient's insurance.
Hmm.
So the way a patient could explore this is by looking to their insurer, whether that's a Medicare, Medicare Advantage, or a Medicaid, to see under what policy, under what program they might be able to access value-based care arrangement and care. And and there are more and more of those available.
We're talking to Tim Pflederer. He's a nephrologist, and today's Kevin MD article is How Value-Based Care Transforms Chronic Kidney Disease Management. Tim, let's end with some take-home messages that you want to leave with the Kevin MD audience.
I think what I would like to leave is that our patients with chronic kidney disease have many severe medical problems that are difficult to care for in isolated episodic care. What value-based care allows is for us to bring a team of providers to wrap around the patient, walk the journey with the patient, and help that patient and their family live their life as they want to live it to the fullest. And I think I'm excited about how that is transforming care for those patients and help more have access to that over time.
Tim, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.